Vatican says Pope suffered breathing problems in hospital. The Vatican has stated that Pope Francis, who has been battling pneumonia for 2 weeks, has experienced an isolated breathing crisis in the hospital. Following the bronchospasm, coughing, it resulted in an episode of vomiting and a sudden worsening of his respiratory condition on Friday. The 88-year-old had to have his lungs aspirated to get rid of the vomit. And now he gets gas through a face mask to help him breathe. According to sources at the Vatican, the Pope's doctors need 24 to 48 hours to determine whether his condition has changed or been damaged. They are not offering any predictions at this time. According to the sources, the Pope is still alert and in good spirits. The Holy Father presented an isolated crisis of bronchospasm, which, however, led to an episode of vomiting with inhalation and a sudden worsening of the respiratory condition. The Vatican stated in a statement, in the early afternoon of today, after a morning spent alternating respiratory physiotherapy with prayer in the chapel, the Holy Father presented an isolated crisis of bronchospasm, with a good response to gas exchange. The Holy Father was promptly broncho-aspirated and began non-invasive mechanical ventilation. The most recent crisis occurred around 1400 local time, according to Vatican sources, but they did not specify how long it lasted. This latest incident occurs after Vatican statements had been slightly more upbeat for a few days, stating that the pontiff's condition had slightly improved. He received Holy Communion today. The Vatican had stated in an earlier medical update this morning that the pontiff was improving and would remain in Rome's Gemelli Hospital due to the complicated clinical picture. On February 14, the Pope was admitted to the hospital after experiencing difficulties breathing for several days, before being given treatment for bronchitis. He was told he had pneumonia in both lungs. The Vatican then issued a statement on February 22, stating that the Pope was experiencing a respiratory crisis and was in a critical condition, however. On Sunday, the Vatican issued an update, stating that the Pope had not presented any further respiratory crises. The head of the Roman Catholic Church has been hospitalized multiple times. In March 2023, he was treated for bronchitis at the same hospital. Pope Francis, a Jesuit from Argentina, is the first Latin American to lead the Roman Catholic Church.